Welcome back to Patch. I'm Chris, and today I'm going to be talking to you about a multi-level perspective on substance abuse and public health. It is apparent that substance abuse is a cross-disciplinary topic of research and concern, which involves the need to employ concomitality, various theoretical expectations, and empirical evidence, and collaborative efforts to strive for more optimal solutions to limit its contagious and to curb any direct and indirect harm. Substance abuse has been described as a chronic relapsing disease with extremely high relapse rate that range from 56.8% to 81.8%. For a comprehensive understanding of the nature and process of and impact of substance abuse on the human individual and societies as a whole, an international exchange of the latest scholarly views and empirical research findings is needed. This special issue, Substance Abuse, Environmental and Public Health, aims to promote international exchange of empirical academic works on substance abuse and its related concerns. When researching substance abuse and its harmful effects, researchers predominantly focus on certain social groups with a higher tendency towards substance taking and misuse, such as adolescents and male adults. Substances that are misused and abused can be categorized into two forms. These include illicit and legally approved substances of various types. The most commonly illicit type of substance include cannabis, amphetamines, ketamine, methamphetamines, cocaine, ecstasy, and heroin, which are largely banned in most countries. However, marijuana products have been recently legalized and commercialized in the Northern American and Western states and regions under the umbrella of control and reasonable use, which casts a contemplative doubt over the original intent of reducing cannabis-related criminality and public health problems. Hence, more research is needed on this subject. As has been mentioned, substance abuse is a public health concern that involves human biology and physics needs, psychological demands, cognitive and spiritual fulfillment, and environmental formulations. Therefore, cross-disciplinary research using different methodologies and designs is much needed to scrutinize substance abuse and the respect of etiology, maintenance, consequences, abstinence, and relapse. For quantitative research designs, study findings based on representative samples or any of the random sampling procedures are desirable and can strengthen empirical evidence and provide greater external validity. For example, investigated whether those who had current or previous experience of facial flushing would drink procedures proportionally in 82 colleges in South Korea. The abuse of alcohol and drugs has resulted in significant morbidity and mortality among adolescents worldwide. Many of these youth will lose their lives to drugs and alcohol, and a significant number are likely to grow up and become problem drug users. Although the substance research available to physicians, community leaders, and schools to implement interventions that can decrease adolescent substance abuse rates. Because this issue is not peculiar to any one community or culture, we recognize that individual interventions may not be universally effective. Therefore, we emphasize that the NIDA strategy, or targeting modifiable risk factors and enhancing protective factors through family, school, and community prevention programs as a generalized framework for healthcare and community activists to use when researching programs and strategies best suited for their own community. Thank you. Have a wonderful day.